Good morning. I'm Phil Owen, a peer recovery coach at Communities for Recovery and the Targeted Response Team. Today I have my very special guest from the SIMS Foundation, Patsy Bouressa. Good morning, Patsy.
Hey, Phil, how are you?
I'm doing just fine. Can you give us a little background about yourself?
Sure. I am the executive director of the SIMS Foundation, and I've been in that role for the last, officially for the last 5 months, unofficially for almost a year as I was interim. Prior to that, I was the clinical director here. I've been a social worker since 2006, and prior to that, I had a 14-year career in human resource management. But once I shifted, I spent my first 6 years as a social worker, working with kids in a facility for mentally ill kids. And then I worked in the prison system. I did that for Travis County, and was out at Travis State Jail working with those guys out there for 5 years. And then I spent a teeny tiny bit of time at a psych hospital, and now I'm here.
Great. So the SIMS Foundation, can you give us a little background on the SIMS Foundation and where they fit into our local community?
Absolutely. So SIMS Foundation has been around for 25 years now. We were created in the aftermath of a musician by the name of Sims Ellison, who died by suicide. He had suffered for years with depression, and the folks around him at that time knew that he had depression, but I don't think we're really aware of how much he was suffering. And then when he died by suicide, it really shook the Austin music community. And his family, along with a couple of other people, Don Harvey, Alejandro Escovedo, Wayne Nagel, they got together and created SIMS Foundation with the idea of helping musicians get access to affordable counseling. Since then, we do much more than that. We have musicians, music industry professionals, and their dependent family members are part of our client base. We have every range, every access point to mental health coverage, to all the different levels of care, to substance use treatment and all the levels of care for that in our network. So we basically have a network of providers who do every type of service for both mental health and substance use, and they do it at a reduced rate for our clients. So we're able to not only support our clients when they come to us and help them understand what the different levels of care are and what might be best for their particular circumstance, we have a whole range of people with skill sets that we can more appropriately match to the most appropriate person. So we're making sure that our clients really they're not only entering the level of care that they really need, but they're also getting the best provider for their particular needs.
Great. Well, you know, when I think about, we have mental health and we have substance use issues. I think about my own personal experience. I think I clearly knew I had substance use issues, but I don't think I recognized any of the mental health issues I had going on.
Yeah.
And when I think back on it, I think clearly there was an emotional roller coaster taking place throughout all this, which certainly the drugs enhance. But I think about anxiety and depression a whole lot.
Mm-hmm.
You know, and I think probably my ego played into this a great deal too, because I didn't want to think, and it's odd because I think that I, on one hand, was kind of proud of my drug use because I identified with it and felt it was part of the job description as a performer.
Yeah.
But my mental health was an embarrassment to me. And because I didn't have a diagnosis or wouldn't go to get a diagnosis, I swept that under the rug and ignored it. And probably would have gotten upset or debated about it had somebody tried to help me with it at the time.
Right.
So it almost appears like there's two different doors that you walk through, but the truth of the matter is a lot of times they walk hand in hand, correct?
Yes, very much so. And I think you just described it beautifully, whether you're a performer or you're an accountant or you're a secretary. Oftentimes, as we know about addiction, people can be genetically hardwired through generations of people suffering with this disease. But at the same time, often people sort of open up that Pandora's box of a substance use disorder because they're trying to deal with some sort of emotional dysregulation that, just like you said, they don't want to look at it. They don't want to accept that maybe something's wrong. We all know that mental health issues come with an enormous stigma. Why? I don't understand, because it's just a chronic illness, just like diabetes might be. So you often wrap up your substance use to kind of shove that aside. And then when you get healthy and you start to get into your recovery from substance use issues, all of that stuff you were masking kind of bubbles back up. So yeah, it definitely, they go hand in hand. You very rarely see somebody who experiences any length of substance use disorder come out of that without some sort of trauma or emotional issue because of just everything that happens when you're lost in your addiction.
You know, I work with many peers, musicians as well as non-musicians and music industry people, and you know, I think we see this a lot. As a matter of fact, one of the guys I work with tells me he had no clue about his mental health issues until he sought substance use issue services, and
Mm-hmm.
I think that is probably pretty common.
Yes, very. And I think one of the things that I share with our clients when they've maybe done that residential treatment, that rehab dance multiple times trying to get into recovery, I'll have conversations with them about the piece that often is missing for them is they do great when they're in treatment, right, in a facility. But once they leave, they feel like their recovery's solid, but they're not facing the emotional trauma that's been happening or could possibly have been underlying their substance use issue. So they don't go to counseling. And that seems to be a huge common stumbling block, no matter what population I've worked with, is they do great in treatment, they're getting all that counseling, they leave that treatment facility and don't continue counseling, and all of those things bubble back up to the surface, and they're not prepared to deal with them, so they kind of fall back on their drug of choice to take care of themselves.
Right. Yeah, I think that you know, you talk about layers of support, and
Mm-hmm.
if I had not had layers of support coming out of treatment, treatment would have just been a 30-day stay in lieu of jail for me.
Yeah, and for many.
And it clearly would not have done much for me because halfway through it, I was literally there for a piece of paper. And the other 2 weeks, I really wanted to change. But sustainable change, I don't think came until probably a year after that, at least.
Mm-hmm.
So when I talk about layers of support, I'm talking about therapy beyond treatment,
Right.
group therapy, um, social interaction with others that are going through the same thing,
Right.
fellowship groups like AA or any other support groups.
Mm-hmm.
I also think about, I went into sober living. SIMS helped me get into sober living, which I did not want to do.
Mm-hmm.
I
Yeah.
was not happy about doing it until weeks into it, I think. And then
Yeah.
eventually I stayed in sober living for 4 years.
Yeah.
But I look back on it and I think, you know, for me, turning 50 in treatment and having never tried to clean up before,
Mm-hmm.
I don't think I could have done it any other way because sober living allowed me to sit still long enough for
Right.
recovery to become the norm again.
Yeah.
And so I just wanted to hear your thoughts around layers of support and what that might look like. And I know that SIMS has been a big proponent of multiple layers of support, and I believe that's probably best practices. Is that?
It is best practices. I mean, there's a reason why fellowship groups like AA are so successful and really help people. What we know about addiction is it's a disease of isolation, basically. It's lack of connection. It's not having other people in your life. We're social animals. Whether you're an introvert or an extrovert, we absolutely need at least one other person to communicate with to survive. And I think in time of isolation right now, people are really feeling that when they're not able to, you know, go out to dinner with their best friend like they normally do on Thursday night. We need that other person or persons. So the layers are many. I think you hit it. I think one of the layers for many is that inpatient treatment, that residential treatment that starts to open up your eyes about what addiction is, one, and what your addiction is. It's really important. And then the next layer will be, you know, if it's 12-step, finding a sponsor, it's finding someone like you, Phil, to be their peer recovery coach. So they have that person who has that lived experience that they can trust and they can tell everything to and not feel like they have to keep it secret. It's being in sober living for many because it provides that structure that when you're out on your own, no one can really provide for themselves. It's not like you're going to drug test yourself on occasion to make sure you're still on track. It's not like you're going to be able to set a schedule and reinforce it and make yourself go do those things. So many people need that extra sort of structure and push to continue down that path of recovery. It's having a counselor so that you're working on either the underlying mental health issues that led or fed your addiction, or to deal with the aftermath of what happened in your life while you were lost in your addiction. And that's a supremely safe space to tell absolutely everything. That's a person who will help carry it, who will help walk you through how to process it and come out the other side a healthier person. But it's also having people in your life, whether they have lived experience or they don't, that you trust enough that you can turn to and say, I had a thought about using today. I drove by the corner that I used to get my crack from and I almost stopped. And have that person that's safe, that won't judge you, that won't be triggered themselves for fear that you're going to go down a bad path, right? So it's all of those layers. We can't go through this life kind of doing it on our own. And we need to find, when we're in an addicted state, how to come out of it safely. We also need to know how to continue in our recovery in a safe way, and we need other people to do that.
I agree. You know, you mentioned isolation. Oftentimes we talk about addiction being isolation and recovery being connectedness.
Exactly.
So amidst the COVID-19 pandemic, which we're recording in right now,
yeah,
what we're seeing a lot of is what we're coining as COVID-19 isolation fatigue. Means that
yes,
the energy that we've had to sustain, for those that had a positive note coming into this, we're seeing a plateau to where now support groups aren't enough. Support group numbers are falling off. One-on-one interactions are falling off.
yeah,
You know, so I think now we're kind of seeing it as coaches, our duty to start thinking outside the box.
mm-hmm.
What does recovery bingo in a Zoom room look like? Or
yeah,
we're trying to think I think that as we go through this, because we're not in the clear yet.
no.
And I think still we're going to find these services of online supports ongoing even as we enter our new normal.
Right.
Your thoughts about the new normal? If you looked into your crystal ball, what does that look like?
Yeah.
A hybrid system? Are we going to keep functioning as separate organisms, or is wellness or healthcare models as a whole going to become more of a single organism?
You know, I don't necessarily know what the new normal will look like. The things that I've seen is for support groups, for example, or meeting with your peer recovery coach, or even talking with your counselor, having all of that being moved to video is having an impact. And I don't know just yet if it's across the board negative, but the reports that I get when I'm talking to our clients are, especially around support groups, is I'm not going to my support group anymore because I don't get anything out of staring at the television, is what basically it feels like. And I'm a very social person myself, so I get that. Like this, it's great to see your face, Phil, because you know we work together, we know each other, but it's absolutely not the same as seeing you in person or being able to go and do a training with you in person. So I feel that distance, and I'm hearing that from our clients. I have heard from some though who are like, wow, I really like that I'm able to see my counselor and still engage during this time. So there's an appreciation that we have this technology, that people weren't just automatically stuck now having to talk on the phone and not be able to see anybody. So it's kind of a mixed bag. You know, we already had things like Talkspace and Headspace, and I remember what all those online counseling things are, and those have been in place for a couple of years. And as a therapist myself, I can't personally, as a professional, wrap my brain around how I would do that as my primary way of doing counseling. Because for me, as a counselor, I get so much from my client in their body language, in their facial expressions that I can kind of see in video, but also get kind of distorted with delays and things like that. You don't really pick up the same kind of voice tones over this kind of medium than you do in person. So for me, I feel like counseling, for me as a professional, is lacking something. And maybe that means something about my lack of skill, I don't know, but it bothers me not being in the room with someone. But at the same time, again, I'm thrilled that we have all of this. I can't even imagine, we're in our 7th week of lockdown at SIMS, and to not actually be able to see my coworkers and really talk that way and strategize and plan and come together over Zoom to talk about how to take care of somebody, that's really important to the work we do. So I appreciate it, but I guess I'm hopeful that we won't keep this as our norm, that we will go back to at least a hybrid of in-person or video. And I do know that there are some people who get so anxious about trying a support group because they're walking into a room of strangers.
Right.
I could see that being used as sort of like an entry point for some that are too anxious to walk in the room. So I am thinking there's going to be some sort of hybrid opportunity there, but I sure hope we never go to it's all over the internet, because that just to me feels lacking.
Yeah, I'm the same. I hope we don't get, for any reason, forced into a way of this is the new norm. I think it's to add another layer of interaction, but we've got to remain flexible enough too. But it'll be interesting to see as we come out of this. I think, one of the things that I've heard in the medical community is that Medicare and Medicaid, at least temporarily, are paying for telesupport.
Yes.
Maybe we come out of this and gain that, because that's very helpful for people in rural areas.
100%.
So I just keep trying to do the upspin and look for the bright side, what we're going to gain out of this, and not worry so much about what we're losing during it. So I have a somewhat personal question for you. I'm thinking back when I was struggling and looking for services and knowing nothing about mental health services. And I kind of now know the difference between a psychiatrist and a psychologist. But if somebody is struggling and is unsure of what service is going to fit them the best, how is it assessed, or what are the determiners for somebody to know if they need a psychiatrist, a psychologist, or a therapist?
That's a great question. Kind of my rule of thumb when I meet a new client who is struggling in whatever way with some sort of just issue in their life, and are hesitant to explore medication. So let's say a client comes to me and all of their symptoms, everything they're describing is really depression, but they really don't want to have any medication, or they don't understand it and so are fearful of it. Or somebody who's just exploring, I don't know what's going on with me. I often tell them, let's get you connected to a really good counselor, right? A therapist. So that could be in the form of a licensed marriage family counselor, could be a licensed clinical social worker, could be a licensed professional counselor. So when I say therapist or counselor, all of those certifications apply. And that's a person that you go and you do talk therapy with, right? That's who you go and you share what you're struggling with, and you have those in-person sessions where you're really exploring your life. The value in starting there, if you're not really having any super serious symptoms that put your life at risk or others' lives at risk, right? So if it's somebody who's just struggling, they're able to articulate it, therapy is a great place to start, because once you build that trusting relationship with that person can then provide what we call psychoeducation, which would be now explaining to their client, okay, here's what I've known over the last so many months. This is what I think. I think maybe you suffer from blank or blank, right? Medications really could help. Why don't we set you up to go see a psychiatrist or a psychiatric nurse practitioner, because both can prescribe medications, just so that you can understand what your options are. Not that you have to go get on medication, right? But let's explore it. And so those two that I just said, psychiatrist and psychiatric nurse practitioner, they both are able to prescribe psychiatric medications, psychotropic meds. Their role really is to meet with the client, understand all the symptoms, really delve into their health to actually diagnose them with something, right? So in the case of somebody with depressive symptoms, maybe they go to the psychiatric nurse practitioner, they meet with them for, an hour. At the end, that person's probably going to have a pretty good idea of what they think they're suffering from, and then can provide that psychoeducation around, here are the medication options. This is why I would choose this med for you. And here's how this would work, right? So those are the medication prescribers. Psychologists are kind of in between a therapist and a psychiatrist, in the sense that they too often will diagnose. I mean, all of us are able, and it's legal for us to diagnose people, but often therapists are not so much focused on a diagnosis. We're much more focused on the individual and the symptoms that they're experiencing and how to help them deal with them. A psychologist can do things like extensive testing to really delve into what the actual diagnosis is. They cannot prescribe drugs, but they do also do therapy. So you can go to therapy with a psychologist. They may have a different approach to it than, say, an LPC might, but they would still do counseling with you. They just have that extra layer of being able to do a lot of testing that they're certified to do.
Gotcha. Great. That clears things up for me in a
Kinda.
well, it's often a very I think it's clear as you laid it out as clearly as it can be, because it is confusing. Even if you know all that information, just to figure out what's best for you, and oftentimes, it's a fine line between seeing a provider and getting some consult, or seeing multiple providers and getting multiple consults.
Yeah.
And some of those overlapping bubbles can be confusing.
It's very confusing, Phil, and I get that all the time, where people will say, well, I went to see whatever type of profession and they told me this, and then I went over here and they told me that, and it can be really confusing and strange, right? And that's where you need to ask questions. I know people often get really fearful of going into a office of somebody who's a professional and then questioning what they're being told, but you need to, over time, if you struggle with these things, to become your own advocate. So if somebody's diagnosing you with something super strange and you absolutely do not agree with it, have a conversation with that person about why. They may have seen or heard something that you're not privy to or aware of, right? So I think that's really important. And the other thing to know is there's so many other levels of care. So we've got people who do individual counseling, couples counseling, family counseling, but we also have intensive outpatient programs that are a little bit more intense in what they do, and you go about 3 times a week to group counseling on a particular issue, and you go for maybe a couple of hours each day. Then you've got partial hospitalization, where you're going Monday through Friday. You would have access to actual medications while you're in that program, working on yourself in group all day. And there's so many layers before, if somebody's really struggling with a mental health issue, before you ever get to having to be admitted to a psychiatric hospital, which really should never be what happens. We should have a system where people are taken care of way before they ever have to enter into a psychiatric hospital, because those levels of care are really important and they keep people safe and alive, but they're also very traumatizing. Being inside a psychiatric hospital is terrifying. And to go in there with something like severe depression, thinking you're going to have this peaceful place to kind of reset and take care of yourself, is just not what happens. So I just wish, as mental health professionals, people did a better job of making sure their clients knew all the levels of care to try to really keep them out of that highest level.
To find the right fit.
Exactly.
As I said before, I'm a proud SIMS client, and one of the things I appreciate about SIMS is their help in navigating the system, because everything you just explained was what made it less overwhelming for me.
Yeah,
and
for sure.
To take the advice that was given and select a service that was appropriate for me. And I'm thinking of people that are not musicians or music industry or their families. Locally in Travis County, I think the go-to would be Integral Care to help assess with that sort of thing. So Integral Care would be 512-472-HELP if you're not a musician or music industry in their family. But for the SIMS Foundation, how would somebody go about connecting with services?
The easiest way is going to our website, simsfoundation.org, click on Get Support, and then become a client. And there's 2 forms out there that the person would fill out. They can also just call us. Our number is 512-494-1007. And that phone number, actually, anyone in our community should feel free to call us if they have questions. We help people who are not in the music industry every single day. We don't want anyone out there trying to stumble around and figure it out on their own. So we have spoken to people from all over the country and have helped them find the level of care that they need in their part of the country. So we want to be that community partner for people. But to become a client, it's super easy. You just fill out those 2 forms, and then we give you a call and get the process started.
Great. I would also like to point out, too, before I take the screen share off, is our picture view is covering it up. But should anybody feel so inclined, the Donate Now button is in the top right corner, and SIMS Foundation does a lot of great service for our local community. So should you feel inclined, please click on the Donate Now button and help out the SIMS Foundation as they help many musicians, music industry, and their families get into mental health and substance use services.
Yeah, thank you, Phil.
You bet. So Patsy Bouressa from the SIMS Foundation, thank you so much. I've got one last question for you.
Okay.
If you could create your own flavor of ice cream, what would that flavor be?
I don't even know how to answer. I guess I'm going to answer it in a really lame way. Chocolate mint is my most favorite thing. I don't think you can improve on that. So I would just slap our name on it and call it SIMS chocolate mint ice cream.
Well, you can't argue with the classics. So
That's right. You just can't.
Perfectly acceptable answer. Thank you so much, and have a great day, and everybody tune in again.
Thanks, Phil.